Hey guys, I want to talk to you today about the water that's flowing through our dental units. Okay, this is one thing that's pretty not well known in the world, even among dentists. So come here, let me show you what is inside of a dental unit. See all these lines in here? These are all water and air lines. You can see how small they are. And the water flows through these lines and through all these tubes. And so there's a lot of little tiny lines, a lot of surface area that water flows through. So what happens is you get a lot of gunk build up in those lines, bacteria and slime and who knows what else is in there. And so we have to work really hard to keep these lines clean. There was a case in California, in Anaheim. I think there were 68 kids that got sick, like really serious dental infections from dirty water being used in the dental units. Well, the water was probably clean, but then after it flows through these lines, it gets dirty. So here in my office, what we do is we actually treat the water with what's called ozone. This is my ozone unit here. Only thing it is just some oxygen. Here's my oxygen tank. Flows through this machine, and it adds energy to the oxygen, changing it to ozone. And the ozone is what we use to clean our water, and then the water soaks up that ozone. Then we run the ozonated water through our dental units, and that keeps the bacteria down and keeps our water lines clean. So to show you how the ozone works, let me show you with a latex glove. And I'll just pipe some ozone onto my glove and show you what happens. Okay, can you see that? So that's just a latex glove, and that's what happens when ozone touches latex. But it doesn't hurt my hands, it doesn't hurt my skin or anything like that. But it totally destroys the latex. And so something similar happens when the ozone comes in contact with bacteria or viruses, funguses, anything like that. It just totally wipes them out and annihilates them. So next segment, I'm going to show you our ozone system at the new office and how we built it all in and integrated it actually into the structure of the building. So we have ozonated water, not made separately that we then have to put into the units, but it just flows directly to the units. So this is my built-in water ozone unit. So you come over here so you can see. Here is our just potable water from the city coming in. And Vernal has really high quality water. It's what we call 85 total dissolved solids, 85 parts per million total dissolved solids. And so it's not really dirty, so we don't have to clean it too much. So we just run it through 3 filters in series. That gets our total dissolved solids down even more. It runs into this machine. And it doesn't have an external oxygen source like my units in the office do, but it hydrolyzes the water into hydrogen and the oxygen it gets from hydrolyzing the water is what it uses to make the ozone. And so then that ozonated water, the water that's saturated with ozone, flows into this tube, into these pipes down here, and that's what feeds our dental units. So all the little spray going in your mouth, the spray coming out from the drills, the spray with the little ultrasonics to get your teeth cleaned with, all the water is treated first with the ozone to keep it nice and clean. Okay? Alright, so the water is piped directly from in the back where you saw, and it's just going to come through here to all my little instruments, come through directly. So all the tubing, remember the tubing I showed you on the last, at my old office, that just gets caked with bacteria and yucky, these will never get that way. These are brand new, so they'll stay that way. And you can even take a really old dental unit that's caked with that biofilm, and if you run ozonated water through it, it'll clean it and make it, well, once you get out of the gunk from it, then they'll be good as new. So we're super excited to have this clean water for our patients, and with that we'll be able to deliver higher quality dentistry, and the winner of course is the patient as always. This unit here on the wall, this is another ozone water creating machine, except for this one isn't meant to treat the dental units and everything. This produces higher concentrated ozone in the water. So it just comes up this little spout here. So this is what we use to irrigate, say, our root canals with. We irrigate when we, any surgeries that we do, dental implants, for example, or removing wisdom teeth, things like that. We rinse with this water. Really cuts down on post-operative infections, discomfort, pain. And also we can just wash our hands with it. Makes our hands really clean without having to use soap all day, which then irritates skin. I have very tender skin. I have to take care of it. Okay. Thanks for watching, guys. We'll see you later.